Hi everyone, it's Azusa. Welcome back to my channel. So today I'm gonna be talking about my clinical exam experience that I took in America to be a licensed dentist. So there are two kind of big examinations to be a dentist in America. The first one is the written exam. Basically, it's a computer-based examination, so it's not exact like written exam. You don't have to write, but basically you have to show your basic fundamental knowledge about basic science or dentistry, which is called NBDE Part 1, Part 2, or INBDE, and the second one is the clinical examination, which is the exam you have to show your actual hand skill. So today I'm going to be talking about clinical examination. I'm going to talk about what is the exam, what kind of exam it was, and how I practice, and how much I spent for this examination to pass this examination. So firstly, I'm going to start from what kind of exam was that. But this is exam, so there is a confidentiality and I don't want to violate it. So about this section, I'm just going to talk about everything I'm going to talk about from now is on the official guideline, candidate guideline. So if you want to know more detail, just go to the official website of the test agency and you can just, download a PDF from there. So the exam I chose because the clinical exam, you can pick a test agency. So I chose WREB because several of my friends already took it and I could get the information from them. And the WREB exam is the Western Regional Examination Board. So which exam you have to take, it depends on your future plan. It depends on the states you want to go in the future. You have to make sure which test agency will fit to the states. So I choose the WREB, and the WREB has 4 sections for this exam: operative, perio, endo, and pros. And for 2020, because of the COVID situation, they are doing kind of irregular system. We don't really have to bring patient to the exam site, but usually we do. So today I'm just going to talk about general information, not the irregular 2020 version, because I don't know when you're watching this, maybe next year general information is more helpful. So for the operative section, we have to bring our patient who has right fit cavity. We have to screen our patient by ourselves and take x-ray to show the patient has a cavity. Right here, we have to send it to the test agency, and the test agency will say yes or no. So if we got yes, we have to bring the patient on the exam site, and you're gonna do the cavity treatment right in front of the examiner. So basically, we have to get the class 2 or class 3 cavity, and of course we're going to do preparation, and we are going to do filling with composite or amalgam filling. We can choose either one. Of course everybody choose composite, but amalgam is another choice you can choose. In the perio section, also we have to bring our patient, and the patient have to have the deep pocket, the periodontal pocket, and also the patient has totters, and we are gonna do SRP, deep cleaning, in front of the examiner, which is the exam we need patient. We need to bring our patient, perio and the operative, and the rest of it, endo and pros, we don't have to bring our patient because it's a mannequin based exam. We are going to use plastic tooth. So for endo, what we have to do is the 2 treatment. The first one is the molar access. This is just the access opening. So if you can show orifice, that's it. And the other one is we have to do incisor root canal treatment, which is from access to filling. We are going to start from open access on the incisor, and we are going to take out the pulp tissue kind of thing. It's a plastic tooth, so there are like a jello kind of thing in the tooth. So it is, it is supposed to be pulp tissue. So we're just gonna take it out and fill with catapulture and take x-ray. So we are gonna submit x-ray. That's the exam for endo. And then lastly, pros. So for pros, we are gonna do 3 tooth shaving. The first one is all ceramic preparation, all ceramic crown preparation on anterior. And we are gonna make, no, not the make, we are gonna just prepare the bridge, cast bridge or PFM, either one is fine. We are gonna shave anterior abutment and posterior abutment. Just the preparation, we don't have to make it, we don't have to, deal with wax or casting. So that's the pros examination. Nextly, I'm gonna talk about how I practice for this exam, because if you are not new grad, you have to find a place to practice, right? But actually, I kind of had a confident at the beginning for this exam because I am doing general dentistry for a long time, so I thought this is gonna be easy, but it's not. I highly recommend you to practice plastic tooth a lot, because if you are familiar with shaving real patient tooth enamel, it's gonna be so difficult to do same thing on the plastic tooth. Every one of us practice on the plastic tooth when we are in the dental school. I know that, but for me that was like more than 10 years ago, so I really recommend you to practice on plastic tooth a lot. So I asked one of my friends who is working at the hospital, and he shared his space for this exam preparation. I asked other friend who had his own practice, general practice office, and he actually let me use his private practice office if he doesn't have his patient in the daytime. So I went to his office and practiced with the, with his dental unit. That was very, very helpful for me. So I highly recommend you to practice a lot. So most important thing practicing for this examination is follow the candidate guide, because there is an evaluation sheet and there are numbers, like if you're gonna do all ceramic crown, axle reduction is gonna be like 2 millimeters, like 1.5 to 2 millimeters, and there are all numbers you're gonna be required on the exam day. What you have to do is follow the candidate guideline, follow the numbers, read everything. I mean everything on the candidate guide, and just follow the instruction. That's the exam, I know you are a great dentist and I know you have your own way, but just forget it while you are taking this exam and just follow the instruction. So lastly, I'm gonna talk about how much money I spent for this exam. So jump to the conclusion. I spent about $4,000 because firstly, you have to pay the exam fee, exam itself. It costs like $3,200 to $3,500. It depends on the exam site. Some states require like $3,200 and other states require $3,500. I don't know why it's different, but basically that's the exam fee. And also I spent like $500 to $600 more for this examination to get the practice tooth and burrs. I used a website which is called Steven Dental Solution. I really like that company. This is not my sponsor, but I really liked it because they deliver very quick. 3 days after I bought it, I already got it on my hand. I bought plastic tooth for pros, incisors, premolar, and molars. Each tooth I order like 10 to 15, and each teeth is like $2. I paid like $100 for pros, and also endo is very expensive. For each teeth it costs like $20 to $25, depending on incisors or molars. But there is a pulp kind of tissue, and structure of tooth is a little complex than pros tooth, so it's expensive one. And I got 5 molars, 5 incisors, so I spent like $200 for endos. So I spent about $300 to get plastic tooth for practice. I got a lot of new burrs because during I was practicing, many other doctors recommend me to use this burr, that burr, so I got everything what I told, because I didn't get any education, any general dentistry education in America, so everything they told me was, I felt like everything they told me was the right thing to do. So I was very worried about this exam, so I got everything they told me. but I didn't end up using it because, you know, whatever I already used to is the one I should use on the exam day, right? But it was good experience. I learned a little more extra during the practice. Everybody told me how to do it. So basically I got new Fisher burrs and new diamond burrs, and I got new polishing burrs. I spent like several $100s for this. And also I didn't have a car, so I have to spend several $100s to go to the exam site and the practice place by Uber or Lyft. So that cost me like $100, $200. If you have a car, you don't have to worry about this part. So that's the money I spent. So total cost is about $4,000. And also, if you have to bring your patient on the exam site, many dentists or students likely to pay like several $100s gift card or cash to show your appreciation. So it depends on the, you know, relationship or who you are gonna bring. So that's it. So today I talk about what is this exam and how I practice and how much did it cost. So this is just my personal experience. Oh, and I forgot to tell you my result. Of course I passed. So yeah, good luck everyone, and see you next video. Bye.